Live from the RSV Media Center in Belize City, this is Love TV's Evening News for Thursday, June 3rd. We hope that you had a productive day today. There's a full day's newscast straight ahead, so let's start with a look at the stories that are making headlines today. Memorandum of Understanding for Affordable Hemodialysis Services signed. Belize City Council steps up program to rid Belize City of overgrown lots, and participants prepare for the National Spelling Bee competition. Details of these stories and more are coming up on the broadcast tonight, but first, here is a word from our sponsor. Good evening, Belize. With the Thursday edition of Love TV's Evening News, I am Patrick Jones. People who are afflicted with kidney disease are one step closer to having access to affordable services that will simply make life better for them. That giant step in the provision of hemodialysis services came this morning at the Lions headquarters on Princess Margaret Drive in Belize City. Today's signing of the Memorandum of Understanding for the provision of hemodialysis services to the public comes after months of sometimes acrimonious discussions.
To say that all the parties were in total accord from the outset would be straining the truth, as we were strangers then and a little ill at ease with each other. We were also in uncharted waters in trying to put substance to the concept of publicly available, affordable dialysis services in a country which up to now has only seen privately offered services.
But it all came together neatly, and so when representatives of the Ministry of Health, the Carl Huchner Memorial Hospital, the La Loma Luz Adventist Hospital, and the World Organization of Renal Therapies signed on the dotted lines this morning, it marked an important milestone in the delivery of healthcare services in Belize. Dr. Gary Longsworth is the Chief Executive Officer of the KHMH.
I see the addition of the service at the KHMH as vital, given our position as the only public tertiary care hospital in Belize, and the only one with intensive care services. Happily, the government of Belize shares this sentiment at the highest level, and so we have been assured of the necessary funding to make this dream a reality in the near future, and at a cost that the average Belizean can bear.
That reality was not lost on Minister of Health Pablo Marin, who says that his government is committed to ensuring that those most in need of this vital service can have easy, affordable access to its life-saving benefits.
It's a big milestone for the ministry. It's something that we wanted to move forward. We need to help more patients, and the only way by doing this is combining forces with an organization that can bring down the cost of the dialysis service to the country.
How will the agreement work? I know you're partnering with a private institution, the Loma Luz in Cayo, and the WORD, an international organization. How will it all come together?
According to the memorandum, everybody has their share of the load. WORD is giving us all the equipment, the solutions, and we will provide them with the facilities. Loma Luz is doing the same thing, to use the same amount and have the price reduced to help the patients.
Marin says the government of Belize remains committed to $1.8 million worth of inputs to make the initiative work. At present, 21 people who are suffering from kidney failure are on a government program whereby the cost of their renal therapy is covered by Belmopan. Minister Marin says those patients will continue on the government program, and eventually the number will increase as the program is rolled out and the costs go down.
We need to encourage all Belizeans to stay healthy and to prevent those crises which might result in damage of their essential organs. But for those who do suffer kidney failure, we also need to provide tertiary care. We need to provide dialysis. It should be obvious to everyone by now that this is not a simple matter. It is much more difficult and much more costly. And as always, the truth is that the resources are limited. But by ministering, believe in partnership and hard work. Partnership with PAHO, the SSB NHI, with UNICEF, with the National Council of Aging, with international hospitals for children and other NGOs, with other ministries, education, human development, youth, sports, with other hospitals, combining the strength of the public and private sectors. And now we are very happy to enter with this important partnership with WORD.
President of the World Organization of Renal Therapies, Dr. Wayne Trebin, says that under the contract, his group will work with local counterparts to deliver the best dialysis care to people in Belize with end-stage kidney disease. This, he says, is hopefully the beginning of a long, fruitful partnership.
We have been able to do this in the past, and we will continue to do it, largely through the generosity of companies and benefactors who have donated equipment and monies to us. And while we are working here, one of the things we'll try to do is to help create funding sources so that sponsorship can continue. From our past track record, we've been able to do this, and I have no doubts we can do that here too.
Initially, you were sending 21 units to Belize. Tell me, in terms of dollars and cents, what would that have cost us?
When you say units, with our terminology, the dialysis unit is the institution. What you're talking about is the dialysis delivery machines. There's really more equipment than just that. There's reuse equipment, water purification equipment, dialysis equipment. If you add it all up for the 2 units, it will be somewhere between $1.25 million and $1.5 million worth of materials and expertise, because we're also going to give the training and support that's necessary.
But in terms of the lives it will save, well, that is just priceless.
Absolutely. There is no price on a human life. And therefore, these are priceless. Each life is a priceless treasure to be preserved, and that's what we aim to do.
One man who has been a crusader for affordable renal treatment is Jose Cruz. Today, he skipped a trip to the hospital to be present for the signing of the Memorandum of Understanding because it meant that much to him.
You know, it's an honorable pleasure for me to be in front of you today to address you. I can't see you, and I can't see the expression in your faces, but even I think you're seeing my face, but you don't feel the feeling I'm having inside today. You know, this for me has been a dream that I think would have never been accomplishable. But I never give up, and will never give up, because this is step 1. You know, I like a comment that the minister mentioned in regards to people coming here to assist us that are not Belizeans. You know, and I'm aware that there's a lot of organizations out there that wants to help in many different ways, but for some reasons, and a little bit, sometimes I would say bureaucracy, it's hard for them to come down. But I would like to challenge our ambassadors, you know, our CEOs and our directors, for them to appreciate and realize the benefits that poor Belizeans will benefit from these ventures in the future. Sometimes, my friend, in adversity, when you feel it, you know it. Well, all these patients out here are my friends, and I'd like to urge them to take a little time out and say, hey, nobody needs to die needlessly. Everybody wants to live. With that, my friends, I'd like to thank you all for coming out and being a part of this thing. And Dr. Trebin, thank you, my friend.
Reporting for Love News, I am Patrick Jones. The hemodialysis centers are expected to be up and running by September. You're watching Love TV's Evening News. We will have more of the day's stories for you right after these messages.